Good afternoon to all of you. So I would be presenting our study on indication, safety and outcomes of circle pattern after small incision lenticule extraction. There are no financial disclosures. So circle pattern, as we all know, converts the original smile cap into a complete flap. So refractive lenticle extraction is the newest in the armamentarium of refractive procedures. And for a long time it was thought that retreatment is more challenging. So circle gives us an option around it, and the procedure consists of creating a lamellar ring, a side cut and a junction cut that joins the original cap with the new incision plane to create one larger surface. So the clinical applications are enhancement using excimer laser ablation, removal of a completely retained lenticule, and rescue in case of inadvertent operator errors or suction loss during the last step when you cannot enter a rescue mode and continue from there. Pattern D has been said to be the most optimal with the easiest flap lifting in cases of post-smile retreatment. So we wanted to evaluate the indications, safety and long-term outcomes of circle pattern of retreatment. It was a prospective interventional study of cases undergoing circle pattern of retreatment after smile over a period of 7 years, conducted at RP Center for Ophthalmic Sciences, AIMS, New Delhi. The primary outcome measures were the uncorrected distance visual acuity. The other outcome measures were percentage of eyes within 0.5 and 1 diopter of refractive target, loss of corrected distance visual acuity assessed at 3 months post-circle treatment. In 7 years, circle pattern was performed in 1.49% cases of smile, 15 out of 1,008 eyes. Circle pattern D was performed in 12 eyes. Of these, 4 had intraoperative cap lenticular adhesion, 8 required retreatment for a spherical equivalent of minus 1.5 plus minus 0.78 diopters. 3 had suction loss during cap side cut with completion of laser treatment, in which circle pattern A was used as a rescue mode. Outcomes at 3 months, the uncorrected distance visual acuity was 20/20 or better in 93.3%, 20/40 or better in 100%. No eye lost corrected distance visual acuity, 93.3% were within 0.5 diopters of the refractive target, and all were within 1 diopter. No intraoperative flap lifting difficulties or postoperative flap related complications were observed. So just a case example of a 27-year-old female that underwent both eye smile for minus 5.75 diopters in the right eye, minus 6 with 0.5 still in the left eye. At 2.5 years, there was diminution of vision in the left eye with a manifest refraction of minus 1.5 diopters, 25 diopters sphere and minus 0.5 diopters still was planned for left eye enhancement using a circle pattern. So these were the parameters kept for circle pattern, just to compare the original smile parameters and the new circle pattern parameters. So the incision in smile is of course superotemporal, and we avoid that for planning a hinge during the circle pattern. The hinge is kept nasal at 180, and the lenticule diameter is going to give you the junction cut diameter as well, because it has to create a seamless interface between the new lamellar ring and the original smile lenticule. The lower and upper depth of the circle pattern is plus minus 15 diopters, and we have kept it 130 and 100 because it was 2.5 years post-op, and though the original cap thickness was 120, with time there is some amount of compaction of the stroma, and AIOS2025 showed that the cap now was around 115 to 110 microns, so we have kept the delta as per that. So the circle pattern was applied. As you can see, there is a circular ablation pattern, and this can be easily lifted, and there is a seamless transition across the flap, and the flap was lifted, excimer laser ablation using MEL. The flap was reposited as in conventional LASIK. To conclude, circle pattern is a useful rescue tool for intraoperative suction loss and management of cap lenticular adhesion during smile, and a safe and efficacious method for post-smile retreatment and enhancement. Pattern D is conventionally used. In addition, pattern A may be used as a rescue tool in cases with suction loss during cap side cut when laser firing is completed. Previous studies, there are only few studies reporting safety and efficacy of circle pattern D, none with circle pattern A. So there are only 2 studies in literature. Thank you for a patient hearing.
So, um, how often, like, can you say in percentage, how often in a, say 100 eyes or even 1,000 eyes, do you feel that you have needed to go for a circle pattern? You've
Yes,
used
ma'am.
in 15 out of 1,000
15 out
eyes.
of 1008
Nice.
eyes.
You have
Over 7 years.
oh, you said that.
Yes,
I
ma'am.
missed that. Oh,
Yes, ma'am.
okay. So, any question?
Thank you, sir.
Any comparison with surface ablation instead of
No, sir. Because we, as it is, do not prefer surface ablation because of the haze that may be associated, and as it is, these are our cases from since when we started doing smile. So the interface haze in the starting case, especially when you have a cap lenticular adhesion, may be more, and we did not want to add the haze that may be associated with surface ablation on top of that.
Do you feel that, see, circle software anyway was an intervention which had to be done? Do you feel like I have I have personally seen and I've read many articles that if there's a person has had a suction loss and you do the retreatment simultaneously, some of these eyes regress. There is so similarly in your whenever you've done a circle software treatment, did you see a regression in the results?
We did not with our 15 eyes,
Uh,
and I think this works better than LASIK because of this reason, because you're not creating a second interface as well. This is the same original interface, so it works more like a LASIK treatment than having a two